In this video, I want to talk about an exciting emerging treatment for osteoarthritis, and that's exosome injections. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, as we're talking about something experimental, and exosomes are definitely experimental at least considered by the FDA, I want you to know I am not promoting this. I'm not saying you should do it. I just want to put all the information out there so you have a better understanding of it. I think that the more good information that we can get from good sources, the better everybody can be at making the decision that is best for you. So I want to make sure as best possible you understand that this is an experimental treatment, but I do think it's important to know what's out there and what's potentially coming. Now, osteoarthritis. This is a very, very common degenerative joint disease. It affects millions of people, causing pain, stiffness, decreased mobility as that cartilage starts to break down over time. Now, the traditional treatments are things like pain medications and opioids, physical therapy, anti-inflammatory medications, sometimes even surgery to manage symptoms, but they don't usually address the underlying problem, the root cause. And that's where regenerative medicine treatments, and in particular exosomes, that's where they come in. Now, let's talk a little bit about what exosomes are. They are tiny, naturally occurring vesicles. Some people compare them to microscopic bubbles that are released by stem cells. They carry proteins, they carry RNA and other bioactive molecules that basically are involved in cell communication and cell repair. Now, unlike stem cell treatments, which involve injecting live cells, exosome injections use these purified messengers taken out of stem cells, usually mesenchymal stem cells, coming from sources like umbilical cord, adipose tissue, and a variety of other areas. And then those exosomes are concentrated, and then they're injected directly into the affected joint, whether that's knee arthritis, hip arthritis. And these exosomes work by reducing inflammation, but also producing cartilage regeneration, modulating the immune response and other mechanisms like that. Now, the studies are early. There's no question about it, but the studies definitely look promising. There was a study very recently in 2025 looking at exosomes from umbilical cord mesenchymal stem cells and found to alleviate inflammation and supporting cartilage repair, both in animal studies and the early human trials. There was another study that looked at osteoarthritis. Exosomes improved joint function, reduced pain scores in people with knee arthritis after a series of exosome injections. There was another one that showed enhanced chondrocyte proliferation. Chondrocytes are the cartilage precursor cells, and there was enhanced proliferation of those chondrocytes due to exosome injections. So the cells responsible for maintaining cartilage got proliferated, and it inhibited the destructive enzymes that were destroying the cartilage cells. Patients reported better mobility, decreased pain, less use of painkillers, often months to a year after the fact. Now, these exosome treatments are minimally invasive. That's where it's a lot better than surgery, usually done in clinics and outpatient settings, sometimes done with ultrasound guidance, sometimes not, depending on who's doing it and the joint you're injecting into. Typically takes about 30 minutes, minimal discomfort if you've had any kind of injection, certainly less uncomfortable, I would say, than PRP, and no more uncomfortable than, say, cortisone or hyaluronic acid. That injection site pain typically goes away pretty quickly. Recoveries fast. I've seen patients run later that day, so it's certainly very little downtime. And then people notice improvements. Now, some people will say you get improvements within weeks. I would say it's more like a month or 2 months, sometimes more, before they really start doing their treatments. But you can see improvements a fair amount faster. There's no doubt. But again, I'm not promoting myself. I'm not promoting exosomes and saying you should go out there and necessarily do this. I think it's important to talk to your doctor, especially when you're talking about whether it's off-label treatments or experimental treatments in the case of exosomes. But I do think it is something to consider if you've got hip arthritis, knee arthritis, shoulder arthritis, and you're really trying your best to avoid a joint replacement surgery. Now, if you want a copy of my book, The Arthritis Solution, you can get that free by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, you can click the link in the description under this video, fill out the contact form, and potentially schedule an appointment to see me. Also, I'd love to hear your experience with your injury. Maybe it's knee or hip arthritis. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice there, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.